Have you ever wondered why some viral infections can stay quiet in the body for years and then suddenly return? Herpes is one of them. It is a common viral infection that can affect both men and women, and it can sometimes be present without obvious symptoms. Because of that, understanding the infection, recognizing the signs, and knowing what treatment options are available is important. Welcome to the Biogetica podcast. Biogetica is a global natural healthcare company bringing together Ayurveda, homeopathy, allopathy, yogic sciences, Tibetan and Chinese medicine, and modern scientific research. With a multidisciplinary team of doctors, scientists, specialists, and healers, we offer natural health products, consultations, wellness resources, and evidence-based approaches to whole-person health. We're here to talk about health, Ayurveda, natural wellness, and different approaches to supporting the body. Today we're discussing herpes and the Ayurvedic approach to managing it. We'll look at what herpes is, its common symptoms, how Ayurveda views the condition, how it approaches balance in the body, and some of the natural ingredients that have been studied in this area. A quick note before we begin. This episode is for educational purposes and should not replace advice from a qualified healthcare professional. So let's get started. What is herpes? Herpes is a viral infection caused by the herpes simplex virus. There are two main types, HSV-1 and HSV-2. HSV-1 is commonly associated with oral herpes, while HSV-2 is more commonly associated with genital herpes. However, either type can affect different areas of the body. Herpes can spread through direct contact with an infected area, and transmission can sometimes happen even when there are no visible symptoms. That's one reason why awareness is so important. Some people may have herpes for years without noticing any symptoms, while others may experience outbreaks with blisters, sores, pain, tingling, fever, or discomfort. Common symptoms of herpes. Let's look at some of the symptoms. With oral herpes, people may experience fluid-filled blisters around the lips or mouth, tingling, pain, difficulty eating, difficulty swallowing, and sometimes fever. With genital herpes, symptoms may include fluid-filled blisters around the genital area that can break open and form sores. Some people may also experience painful urination, headaches, fever, or general body aches, but symptoms can vary from person to person. And because herpes can sometimes have no obvious symptoms, testing and professional medical evaluation can be important when there is a concern about infection. How does Ayurveda view herpes? Now let's look at the Ayurvedic perspective. In Ayurveda, conditions associated with herpes have traditionally been discussed using terms such as Visarpa or Parasarpa. Ayurveda looks at health through the balance of three doshas, Vata, Pitta, and Kapha. From this perspective, an imbalance in these energies, along with factors such as diet, lifestyle, digestion, and other influences on the body, may contribute to disease processes. Different symptoms are traditionally associated with different doshic patterns. For example, Vata-related patterns may be associated with pain, discomfort, or dizziness. Pitta-related patterns may involve redness, burning sensations, or fever. Kapha-related patterns may involve heaviness or stiffness. Ayurvedic practitioners use these patterns as part of their traditional approach to understanding an individual's condition. Diagnosing herpes. Before talking about any treatment approach, diagnosis matters. A healthcare professional may examine the affected area and, when appropriate, recommend laboratory testing. Tests can include viral DNA testing, as well as blood tests that look for antibodies such as IgG and IgM. If you think you may have herpes, it's important to get an appropriate medical evaluation rather than trying to diagnose yourself based only on symptoms. Conventional treatment. So, what about conventional treatment? Antiviral medicines are commonly used to manage herpes infections. They can help reduce the severity or duration of outbreaks, and may also be used in certain situations to reduce the frequency of recurrences or the risk of transmission. However, antiviral treatment does not currently remove the herpes virus from the body completely. This is an important distinction. Herpes viruses can remain latent in the body and may reactivate later. Your healthcare provider can help determine whether antiviral treatment is appropriate for you and which approach best fits your situation. The Ayurvedic approach. Now let's come to the main focus of today's episode, the Ayurvedic approach. According to the Ayurvedic perspective discussed by Biogetica, managing herpes involves looking at the body as a whole rather than focusing only on the visible outbreak. The traditional approach focuses on supporting balance through diet, lifestyle, herbs, and rejuvenation practices. The first step is traditionally described as balancing the doshas, particularly vata and pitta, through appropriate dietary and lifestyle choices. The second part involves what Ayurveda calls rasayana, a traditional rejuvenation approach intended to support overall vitality. The idea is to support the body's overall health rather than focusing only on one symptom. Natural ingredients. Being studied. Several natural ingredients have also been researched in relation to immune function and viral infections. One example mentioned in the Biogetica article is Hypericum mysorense. The article discusses research involving an herbal combination containing this ingredient and reports improvements among participants. However, results from individual studies should be interpreted carefully, and more research may be needed before drawing firm conclusions about effectiveness. Another ingredient is monolaurin, a compound derived from lauric acid that has been studied for its potential effects against certain viruses in laboratory and other research settings. Then there's Picrorhiza kouroa, an Ayurvedic herb traditionally used in Indian medicine and studied for its potential effects on immune-related processes, and Prunella vulgaris, another herb that has been researched for its possible anti-inflammatory and immune-related properties. It's important to remember that research on an ingredient does not automatically mean that a particular supplement or formulation has been proven to treat or cure herpes. The type of study, dosage, formulation, and clinical evidence all matter. Lifestyle and overall wellness. Alongside any treatment recommended by a healthcare professional, maintaining healthy habits can also support general well-being. That includes eating a balanced diet, getting enough rest, staying physically active, managing stress, and paying attention to your body's needs. For someone living with herpes, understanding personal triggers and recognizing the early signs of an outbreak can also be useful. And because herpes can be transmitted even when symptoms aren't visible, discussing prevention and safer sexual practices with a healthcare professional is important. Looking at the whole person. One of the central ideas behind the Ayurvedic approach is looking beyond a single symptom. Instead of asking only, how do we deal with the outbreak? Ayurveda traditionally asks broader questions about diet, lifestyle, digestion, balance, and overall well-being. At Biogetica, this approach combines Ayurvedic herbs, homeopathy, dietary supplements, and modern research as part of its wellness philosophy. However, natural does not automatically mean risk-free. If you're considering herbs or supplements for herpes, especially alongside prescription medicines, it's best to speak with a qualified doctor or healthcare professional first. Outro. And that brings us to the end of today's episode. Today we looked at what herpes is, the common symptoms associated with oral and genital herpes, how Ayurveda traditionally views the condition, and some of the natural ingredients that have been studied in relation to immune and viral health. The most important takeaway is simple. If you think you may have herpes, don't ignore the symptoms and don't rely on self-treatment alone. Get the right diagnosis and speak with a qualified healthcare professional about your options. If you found this episode useful, like, share, and subscribe to the Biogetica podcast for more conversations about Ayurveda, natural wellness, and holistic approaches to health. And if you'd like to learn more about Biogetica's approach, Ayurvedic herbs, and natural health solutions, visit www.biogetica.com and explore the resources available there. Thank you for listening. Take care of yourself, stay informed, and we'll see you in the next episode.